Oh, I think it might be now. Okay, good. All right. I think we have all the people here. So Fritz, I'll just do a little spiel from my side. I don't know who's driving on your side, but thank you everyone for coming to this very first so exciting meeting of Milliman and the Universal Health Plan Governance Board, our kickoff. I was thinking, and again, we'll turn it over to you as well, but just super rapid introductions. I know there are a lot of us, but I think it will be helpful because we have some partners here too who weren't here at our first meeting. And then we'll go from there. But if that sounds okay with you, Fritz. Okie doke. Well, I'll start just very briefly. Myself, Mimi McDonald, I'm the Executive Director of the Universal Health Plan Governance Board. I'm going to turn it over to my staff and then to our, I'll call out people's names from the team. So Isabel, since you're at my screen, you get to go first.
Hi, everybody. I'm Isabel Cortellis. I'm the support organizer, her pronouns, and I'm the Executive Assistant supporting the board.
And next, Lee Hastings.
Hello, everyone. I'm Lee Hastings. I'm the Senior Policy Advisor with the Universal Health Plan Governance Board. And yeah, happy to be here.
Helen Belanca.
Hi, everyone. Helen Belanca. I'm the Chair of the Universal Health Plan Governance Board.
And Judy Richardson.
Good afternoon. I'm Judy Richardson. I'm the Vice Chair and Helen's sidekick.
Cheryl Ramirez.
Hi, Cheryl Ramirez. I'm on the Universal Health Governing Board and Health Plan Governing Board, and I'm the chair of the Finance and Revenue Committee. I'm having an IT issue that I need to kind of jump back and forth. That's why I'm leaving and coming back. So sorry about that.
Thank you. And Bruce, on the telephone, you say hello.
Yeah, hi, Bruce Goldberg, member of the board and chair of the Operations Committee.
And we also have, I'm very happy to say, Morgan Shook, who is getting, I don't know, combat paid double overtime. He just had a 3-hour meeting with our Finance and Revenue Committee. Morgan, why don't you say hello?
Yeah, I'm Morgan Shook. I'm a director at Echo Northwest, and we're also staff to the Finance and Revenue Committee, specifically working on the revenue package.
All right, I think that is all of it from our side. Thanks.
Awesome. I will start us off, and I'll ask. I'll do the same thing. I'll call on the team, and I don't know if anybody here or the board actually read the RFP responses or not, but we'll assume that you did not, and we'll just give a brief background on our expertise so you kind of understand the kind of work we do, and then a little bit of the there you go. I'm getting a thumbs up there. So, my name is Fritz Bush. I am a principal and consulting actuary with Milliman. I've been with Milliman about 10 years. Prior to that, I was on the carrier side, mostly Blues. And I came to Milliman in 2015. And since then, I've dabbled in a little bit of everything, but found a home, found a wheelhouse, as it were, in the healthcare reform space. So I've been involved in all manner of different state projects, large and small, that have to do with reshuffling the healthcare state on a state basis, reshuffling that landscape. And so right now we are the public option actuary for Nevada. We are, which is a 1332 and public option state, as well as Maine. We're the actuary there, the signing actuary for their 1332 program. We've done public option work in all of the states that have the public option. I know this isn't exactly a public option, but those were reasonably hot items a couple years ago, where Washington looked at it. Ken helped with that one. Actually, Ken did that one, and I helped him. So we've kind of had our hands in a lot of these types of projects that involve the different segments of the population, how they come together in terms of cost, how you sort of aggregate the revenue, which I know Econ Northwest is doing that piece, which we're glad that they are, because we'll have plenty to do on the cost side, the cost containment. So anyway, we have pretty lengthy experience with that, and we're really looking forward to this one because this is really, it's ambitious. And that's good, right? Go big or go home, as they say. So we're glad to be here. All right, so I'll turn it over to, let's see, first on mine. You're on the screen, Massey. You're next in line. So I'll have Massey introduce himself.
Hey y'all, my name is Massey Worley. I am really excited to be working with you all. My heart and experience is with state government. I've been with Milliman for about 8 months, and I've been a consultant for about 6 years. But prior to that, I was senior policy advisor to 2 governors and also served as a nonpartisan legislative analyst at the state level. So I am really thrilled to be working with you all. I will kick it next to Ken.
Thanks. I'm Ken Laskowski. I'm a senior consulting actuary with Milliman. I've been with Milliman for, I'm going to be probably the old man here in terms of experience, because I've been with Milliman for 20 years now. I just hit 20 years. We'll just ignore the first 5 years, and I have been working on ACA since inception, since it was signed into law. I first cut my chops doing large-scale stochastic projections in 2010 and 2011, projecting how the ACA would impact various markets. So I've had something similar to this this type of projection in my background for a number of years. But as Fritz already alluded to, I do various state reform work, some with him, some that I can't do with him because I actually price in the state. I price ACA and public option plans in the states. As he said, the most recent one I did was the Washington public option assistance, which I think a number of you have also read that report already, because that is publicly available. And yeah, I'll kick it to Kate.
Hi, everyone. My name is Kate Shadle. I use she, her pronouns. I am also new to Milliman. I've been here almost a year. I am part of the Indianapolis team, and we do a lot of work on operations assessments and administrative team building, cost building. But I also came from state government, where I worked as a director of maternal and child health for 6 years. Previous to that, I worked in global health for close to 12 years, working in a lot of universal health plan systems. So I'm very excited and looking forward to the work. Pass it to Raquel.
Yeah. Hi, everyone. My name is Raquel. I am also relatively new to Milliman, about 8 months. I am the project manager for our side. So, expect to see me a lot, but not really hear me a lot. And yeah, really looking forward to this.
All right, that is the extent of our team. So Mimi, do you have a particular direction? We did prepare a couple of slides, nothing extensive, but I don't know if you have a preset agenda here in terms of what you want to talk about.
Well, I thought, just before you guys get into your slides, I will show you a very brief kind of snapshot of where we're at with the Universal Health Plan, kind of what the committee works. All right, and it's not just because I think it's a pretty slide, but I mean, it is. So let me share this, just to kind of give people a sense. So the Universal Health Plan Governance Board, you guys probably know, has 4 really active committees. And so they are broken down. Up here in purple is, oh my goodness, plan design and expenditure. I don't know where that came from. Next here we have, this is our operations. Down in blue is finance and revenue, and green is community engagement in our communications committee. So each of these committees has kind of these big chunks of work. And you will see when I could sort of determine where I really thought Milliman was going to be a big help. I put in, for example, Milliman cost analysis. Now, this was made essentially a couple of months ago. We have updated it mostly where we're at with where the committees are at, but you can see that, and just for people if they're not familiar, our end goal for at least one portion of the work is to have a report that's very, very thorough and complete, and to the legislature no later than September of 2026. But our mission, we really would like to have everything wrapped up with a bow, kind of earlier on in 2026, late Q1 and beginning of Q2, so that we have enough time to kind of workshop it with all of the people in legislation and others getting feedback on the interim. But so just so you know, we're still in, I would say, sort of the heavy development phase. We made a lot of work today on the revenue side of things, and we can talk about that more later, but just wanted to give you all a chance to see kind of like, not a lot of the major decisions have yet been made, but they're getting there, I would say. And I don't know if Judy or Helen would like to add anything more to that.
I think that kind of sums it up for now. Yeah.
If you go back to that slide real quick, put that back up. Sorry, I have a visitor here. So.
I know, how nice.
Yeah, Fritz is supposed to be on PTO today, but he just
I am, but that's why I'm at home. Normally I'm in an office, but I'm at home. So you're aware, a significant number of our team, I can't say exactly how many, have gone back through all the board notes from July, June, May, April, and so we're familiar with this. We're familiar with some of the discussion around the regional risk-bearing entities, and so I think it seemed to me like things started to speed up a little bit starting in roughly March, April-ish, and a lot of the material that is the most current is the bulk of it. And so we did spend some time going through, getting familiar with matching up sort of the RFP response with now where we're plugged in here, which it largely matches up pretty much, those two documents are matching up. And as far as like the Milliman cost analysis there on the top, and really the cost containment strategies, we're thinking that's sort of and you can correct us if I'm wrong here, but that's sort of our big enchilada, right? Which is, we've got to get all the costs together, and then we've got these cost containment strategy levers, such as, can't remember if it was the June deck or the May deck, where you sort of prioritized your cost containment strategy levers. I think it was eligibility, cost sharing premium, provider reimbursement maybe was in there.
Provider reimbursement, yep.
And maybe one other one.
Yeah, just administrative burden and things like that you can say.
Yeah. So how to do that. So anyway, all that to say that we did go back and kind of got ourselves up to speed on that. So.
Oh, that's fantastic. That makes things great.
I think that's accurate. I would add that the other piece that I think is important is the overall economic impact of this plan on Oregon's economy. Like, I know there will be many ripple effects from changing the healthcare system in such a dramatic way. And so kind of an analysis of the full economic impact for the rest of the state in terms of the business and healthcare industries.
Yeah, and we've got a whole host of questions in our deck, and that was actually one of them. We're very interested and excited to work with Econ Northwest. Sorry, I already said it wrong. Eco Northwest, I believe is how it's pronounced, and sort of what that division of labor looks like. So, for example, Helen, you talked about the business impact and stuff like that. That's, I think there's obviously overlap between what those two teams would be doing. Our expertise is not in that. So I'm assuming that we would, that would sort of land primarily in Eco Northwest wheelhouse. But I only bring that up that we have a pretty lengthy list of questions that we don't have to go over today. But maybe we meet with the subgroup, the PD&E subgroup, which I think, Helen, are you chairing that interim?
Yeah, I am chairing that interim. Yeah.
Yeah. Okay. So sounds like reluctantly, maybe.
Well, right. Right. We're still waiting on a replacement board person for the person who left, who used to chair it. So
Yeah.
we'll probably get a new board member in September, and we're hoping to rope them into the job, but we'll see.
Okay. Yeah. So.
Yeah, because Fritz and I discussed, I think we'll need specific honed in sessions where we can just hash out all the things on our mind, all of the different assumptions that we're thinking about, and we have a lot of questions around those. It's not worth, I don't think it's worth it to do with this whole group, but that'll be one of the first things we need to do or as we break down into smaller meetings. In addition to that, so you had that slide up. So I guess how do we see the, we're just getting started. We're getting started now. We need to do data collection on our side. We have interim PD&E chair. How do we see the deadlines moving? Are you essentially, I see our cost analysis is listed for June, July, and August. I don't think I can get done in 25 days. So sorry.
So you're saying you're not going to be ready? No, I know. So I think that some of it we have gone ahead with some of the work, certainly with the help of Echo Northwest and some other things. So definitely this is pretty fluid. I mean, kind of the endpoints out here are more set in stone, but we do have a lot of room within these next couple months. And what we have found is that when we started, working with our consultant group with Echo Northwest, things like they took off dramatically in terms of things that we're able to accomplish. So I have the sort of the statement of work and things like that. And again, we don't necessarily have to do this at this meeting, but we can go over kind of specifics and hit the bigger targets and make sure so that we have the end date, and then we can work it backwards.
Yeah. Yeah, and we've been focusing on the purple section there. Of course, Kate's team is plugging in there in the orange section. So getting deadlines and stuff like that, and sort of interim deliverables maybe nailed down for both of those main work streams would fall into that. Yeah.
And that's perfect, because of course that's the benefits, the eligibility, the reimbursement, that's the whole cost part, and we can't you can't figure out an impact until you have that kind of nailed down. And it's hard to talk. I mean, as we were talking today in finance and revenue, I mean, you're like plus minus $3 billion. So it's we're trying to get it a little more fertile.
Yeah. And just to back up one step too, we're totally on board with this idea of getting as much done in the second half of the year here, and leading up to an early 2026 1Q type of having the lion's share of the work done, because
fantastic.
You're probably familiar with this. There's a lot of spring government work that Medicare bids, as well as ACA work that a lot of our clients do. So, and then the second half of the year, we're not quite as busy. So we're like, this is perfect.
Okay.
That
is perfect.
So yeah,
we're ready for you.
So we're ready to step on the gas here. So.
All right. Well, I'll stop sharing. You said you had.
Yeah, we can go through just a couple things here. This is nothing fancy, but oh, rats, I got it. Let's see. How do I'm not a Zoom guy or Teams, so I always have to figure this out here. Okay. Well, I'll just do I'll do entire screen here, and then I'll just flip it around. All right, so we've already done, how's that look?
Yep, perfect.
Great, all right. Okay, so we've already done our team, so we're gonna skip over that. And then we just put down sort of our thoughts in terms of our approach on each of the, the work streams, with the understanding here that as you put up the nice colorful slide, this sort of mimics that. And I've got another slide here that talks about sort of Kate's piece of it too. But looking at the RFP, looking at all the documents that are out there, it seems like the work that we'll be largely engaged in falls into the PD&E, which is the top purple, I believe, if I remember right, and then the economics and finance, which I actually don't remember what color that was. But in any case, I think the bulk of it is over here on the left. So I think early on, we'll be looking to, I know that the benefit package is, I believe, still in flux. I don't think any decisions have been made on that, but, so understanding that the benefit package, we're fully equipped to value whatever benefit package it is. We do that all the time for our clients. So we definitely have an approach there. Eligibility, I know that's, again, that's a cost containment strategy. So we will have our data, our modeling set up to model those various eligibility scenarios, whether it's, I mean, I know these aren't even feasible, but if you were to do something by income, if you were to do something by resident status or something like that, we would have, in other words, we've gone back and we've looked at all this stuff, and we have this in mind in terms of how we would build the model, so that when it comes to building out the scenarios, we can, be pretty straightforward in terms of how the modeling would kick out a result. Provider reimbursement methodology, again, that's kind of our wheelhouse. That's actually very much our wheelhouse, where we have plenty of proprietary data nationwide and Oregon, across all the different segments that would be, sort of rolling up: public employees, Medicaid, exchange, all of that. And so, the idea there is you'd get a baseline of, well, what is provider reimbursement now? And then what do you want it to be under the UHB? And so we would have all those indices by each of the segments. Can I pause too? I did have one question before I go any further. I couldn't find it in any of the documents. Is over 65 contemplated here as well, as far as eligibility?
Yes.
Medicare, it is. Okay. All right.
That is a great question,
Yeah.
especially considering Washington and what their approach, but it currently is for sure.
Yeah. Okay, good. Yeah. And so then and again, I'm not going to go through all of the cost containment strategy pieces, but really just pointing out that, we'll work with Helen and that board group to really understand that, get all those assumptions built in, and build the model in a way that allows us to iterate on the key levers. Ken mentioned we'd have a data request. I think, there's a number of different data sources that we'll use publicly. In fact, we read through the previous report that was put out in 2022. And they follow very similar methodology. There's all manner of public reports that we'll use. Milliman has the advantage too of having a lot of proprietary data as well. And just recently, and this is in our RFP, but just to make you aware, we have a pretty sophisticated census model that allows us to get pretty accurate down to age and income and the kinds of things that you would want to do and want to know when you're projecting cost and potential revenue sources as well. So we do have that, but we rely pretty heavily on the public data sources as well. Pretty good at using those. One question that Ken and I had earlier today too was, I noticed that Oregon has a all payer. Thank you. All payer database.
APCD. Yeah.
APCD. Yeah. Now we had not planned to use that. In fact, I think when we did the RFP, I don't know that I knew that there was a functioning all payer claim database there. But we had not planned to use that, primarily because, again, we have pretty robust sources ourselves. But I didn't know if the board had an opinion on that. I don't know that the previous vendor who did the 22 report used that at all either. But do you have any thoughts on that, or was there any expectation around using that data source?
So at least since I've been involved, that we've talked about it with the DFR, the state agency, and having access to utilize that, you know, is a potential. But I think it would sort of depend on the robustness of the data and how, you know, if it's far superior, not superior, but if it would enhance the specificity of the work, it could be possible. But I think that we could definitely do a little bit more research, and especially working with our colleagues to see if it would be beneficial. Because it's still, I mean, of course, it's still not 100% complete.
Mimi, didn't the Finance and Revenue just review the expenditures, or sort of revise the work that the committee did on expenditures? And I know Janine was involved in that, and they were trying to figure out what our total expenditures was. I thought Finance and Revenue just tackled that. And they were using data from the Healthcare Cost Growth Target Program. And I thought APAC too. Didn't they just tackle that in the committee, or no?
Well, I mean, there is a rough, I shouldn't say too rough estimate, but there was definitely a cost target, but a lot of that was utilized from the data from the 2022 report we're projecting forward. I know, Morgan, I don't want to speak for you, so if you have any.
Yeah, no, I would say, yeah, so the committee in working off the cost target is chosen just because of the timing, and it's just to pick up the work from the task force, which used the Optimus piece. So we're kind of using that information to bring it forward for a kind of, call it a placeholder, as sort of plan design picks up and can provide better understanding. Because one of the central things that has come up is sort of like, well, under a single payer system, how much administrative costs savings are we likely to have? Who's going to capture those benefits? What does that mean for us in terms of thinking about the money that's already in the system and the money that needs to be raised to close the gap? So that's kind of where we are with kind of like our cost target, is just really updating the Optimus work in places to kind of give us a working, plan target estimate for the time being.
And did Optimus use the all payroll claims database?
I don't think they did.
Yeah.
I think what they did is very similar to what we will do, although I really don't know anything about Optimus. I don't know what they have available to them, but our approach using public data is typically we will use control totals. So a lot of the control totals that you need are public. And what I mean by a control total is you can get pretty good enrollment, and then often you can get PMPM claims costs in aggregate. And then we can use some of our data to sort of impute the different population between the population and the total control, and some of the cost factors that we have. We just impute the cost so that the total population adds up to or composites to the control total. And I think that's what Optimus did as well. When I read their methodology, that's what I came away with.
Okay.
So anyway, and so just kind of a question that we had, and then this is a really simple question, but right now, is there a planned implementation date for the UHP? Is it 2030, 2027?
2030.
Okay. Yeah. Okay. Yeah. So we would be, all right. So continuing down the PD&E here, I don't want to take all the time because I want to have Kate be able to talk a little bit about the admin piece as well, admin and operations. But like I said, our model will be pretty transparent in terms of, the populations. So you'll get a chance to look at those, make sure you agree with all the control totals and everything. Very similar to, there's a nice table in the Optimus report that had that. And then the modeling, will be as robust as possible, just in terms of being able to model the key features of the program. We're not looking to, get down to the gnat's rear end. right? We need the functionality at the level that your policy levers are going to be pulled. So that's why we'll build that so that the scenarios are pretty iterative and fairly easy to reproduce. So we'll, obviously, again, coming from our RFP, so we'll have various phases of it that the board, that we can present at the board, that you can review, and we go back and make changes. And then we plan, of course, to help with the assist within. This is where I think Massey is really going to be a huge asset, coupled with your team, is assist with the health policy guidance and strategy. So, and then just as far as the economics and finance, again, our understanding is that the revenue side is in terms of tax and economic impacts and this type of stuff is going to be largely handled by Econ Northwest. But obviously I think there's overlapping, making sure that the assumptions are consistent and things like that. So I'm going to go to administrative and operations, and Kate, if you want to maybe just jump in and talk generally about what you see the approach as.
Sure, absolutely. So our team has less of a data request, but more we like to have strategic conversations just to understand the scope and goals and what your success metrics might look like for staffing and planning how to staff a UHP. We will take all the information we gather from you all to design an organizational structure with those key leadership positions, what departments there'll be, roles, and how reporting is done. And then we create a staffing plan with administrative costs related to that. We use publicly available data and trend it forward. We can trend it up to 2030 if we anticipate that's a start date. And then come 2030, we do a lot of implementation support. So we're happy to help develop a roadmap now and then support as we can as we get closer to that start date.
There we go. Thank you, Kate. And then, just a couple thoughts on our final report. Again, we talked about the timing. I think we're all agreed we'd all love to see this thing go pretty quickly in the second half of the year, and shoot for the first part of the first quarter. If you've not worked with Milliman before, I'll give you just a little bit of background about how we sort of work a public report like this. So generally our work needs to be standalone. Of course, you can reference our report. Like if you have, I'm assuming our report, very similar to Optimus, will be part of a larger report. It won't be just Milliman's report. But our actuarial report would be a separate section in there that you would reference. We'll provide you really as many drafts as we need to have. I mean, obviously we don't have unlimited budget, so we don't want to be doing 100 drafts, but we certainly provide drafts of our reports to you, and when you get a draft of a report, you should have seen a lot of this already, right? From presentations to the board, the monthly meetings and things like that, and interim deliverables. So you will have a chance to comment on the report and, make various changes that are, within the scope of the report. We also do a process that we call external review. So we actually will circulate our report to all Milliman consultants so that they are aware of it. And we do that for a couple of reasons. One is, the healthcare world is a small world. So we want everybody within Milliman to be aware of what's going on. So if there's other people doing work in Oregon or something like that, they're at least aware of what's going on. The second reason we do that, though, is you often get really, really, really good suggestions in terms of, and external readers who have not read the report and haven't been involved with it will often see things. So it's a part of our quality review process that we'll actually send that to the entire firm, and anybody can comment. And that usually takes us like an extra week. So we try to plan for whenever you need the report. We back up from there to build in time to do that. But that's just an extra step that we take that we feel adds a strong quality element to whatever we turn out. So, and I think that's it. We've got a list of questions. I don't need to go through those right now. I mean, I can, but I don't think we need to take time to do that because we probably will have more. And it may be something where we just want to have a smaller group with the PD&E committee or however you see fit. But so that's basically it. So I'll pause and see if people have any questions for us.
Yeah, we mostly address these questions along the way,
Yeah,
you know,
for the most part. Yep.
Yeah.
Yep.
Well, I think one of the things that, and this may be a little bit too basic for this, but in terms of, kind of meeting things like that, interacting with the people on your team and sort of the overall setup, maybe you can a little bit describe how that ordinarily works for you, especially because I'm sure you've worked with other sort of large groups or large committees before.
Yeah, as far as how our team interacts with the board. Yeah, so I'll be your single point of contact. So I'll be at all the board meetings. You'll probably see Ken at every meeting as well, and Kate as well, as being the sort of the track leads, depending on what we're. And then of course Raquel is. You got to copy her on everything. So she's the brains behind the. She's the brains behind the good looks here on the phone. So, well, she's the good looks too, but I'm going to get myself in trouble here. But anyway, you get the point. She's going to keep us organized.
Make sure nothing falls through the cracks.
That's right. That's right. And so yeah, so you'll see the three of us and definitely copy her, the four of us. And then we've got some other subject matter experts as well. So for example, we have, we didn't want to have a cast of thousands on this meeting, but we do have other resources for things like where the rest of this team is a little bit weaker, like things on pharmacy. So if you have complicated pharmacy questions, don't ask me. I mean, you can ask me, but I'm just going to I'm going to phone a friend for sure. But so we've got some other experts that are not on this call, but you may see them in some of the meetings if we get deeper into Medicaid is another one where if you're getting into Medicaid policy, Massey's going to be really good with that. But we do a ton of Medicaid. So we've got a Medicaid policy expert on the standby as well. So yeah, so if you copy myself, Raquel, Ken, and Kate, we'll disseminate from there.
Yeah, it is going to be a challenge for us to, obviously we understand the budget and there's a budget cutoff, but it's going to be a challenge for us internally. So we're going to try to just keep as focused as possible in meetings. When we address Medicaid, I'm going to bring the Medicaid people in. When we address, just like Fritz said, when we address different challenges, different people will be brought in at different times. And while Raquel keeps us all together and make sure everyone knows enough too. We don't want to be too independent. Yeah.
Yeah. Does that answer your question, Mimi?
Yeah, that's helpful. I mean, I think obviously we'll get into more detail, but I think Cheryl, you have a question.
So yeah, I'm with the Finance and Revenue Committee, and we've been we're really happy that you're on board. I think for us, the question or issue that has arisen the most is to clarify what you're doing and what Echo Northwest is doing in it, so that we're really clear on your roles for our committee. I mean, I think we're really getting to know Echo Northwest, and they're doing a ton of work for us right now. And I think what my committee would like is if you would come and talk to us about what your role is fairly soon. And I imagine Mimi's working with you on that. So maybe like as early as September, just to understand how you will be contributing to our proposals, because we're right in the middle of all of that right now on the revenue proposals. So I think we'd just like to know more about your role.
Yeah, we'd love to do that. and I would suggest we do that a lot sooner than September, if it's possible. I think we could be ready to talk about that and even, present to something a little bit more detailed by as early as next week. Because we're burning daylight here, so
Yeah.
so September's another month away, and so we would, like I said, we'd rather go faster than slower here. So,
Well, much to my chagrin and also probably to the staff, we're having a second meeting this August, so this month. So maybe that's a possibility that you come in and do an overview then. And we have been meeting many months, twice a month. So that probably will happen again in September. So we meet the first week of the month and then the third week. So
yeah,
there are possibilities there.
okay, yeah, we'll plan. Yeah, we'll let you coordinate, or whoever that does that coordination. But yeah, our bias would be sooner. So however you want to work that is fine. So.
I'm thinking too, it would be really useful to have, Morgan is hoping you'd be amenable to meeting with the team from Milliman. I think that'll be, and Cheryl will get you there too and kind of really hash it out and the deliverables and divide. So I think that's super useful.
Yeah, I circled that question on your deck there. We want to get clarity on the places that overlap, but
yeah. And is there any issues, like once we get going? I actually don't know the degree to which, Morgan, your teams and our teams will be over. I mean, there is, I just don't know how deep the overlap goes. And does anybody have any trouble, any angst about like Eco Northwest and Milliman just one-offing and making sure that we're aligned, or does it all have to go through sort of an official process?
You might need to clarify that a little bit.
Well, let's say we get into the project, which we're getting into it, and we find that there's some significant work that needs to be done to make sure that we coordinate the two different models. Does meetings between Eco Northwest and Milliman need to be done, say, with like in a board meeting or in a second meet, like an official UHP type of meeting, or can Milliman just connect with Eco Northwest on their own? That's okay to do that.
Yeah, you guys, it certainly doesn't have to be in sort of follow public meeting laws or anything like that. We will probably have one of our staff people join, just so we can kind of keep track of everything.
Yeah. Okay, great.
And just by way of background, I might just jump in here and kind of explain the relationship. I don't know if it'll help, but our original idea was to have a single contractor for a very large amount for this work and help us with everything from eligibility benefits, the actuarial analysis, cost containment, the revenue strategy, kind of put it all together. We were thinking originally that we would have one giant contract with one firm and have them parse out the work as they saw fit and just kind of, here's what we want to do, how can we make that work? That was the original idea. However, once we got into the nitty gritty of how state contracting works, we realized it was going to take a very long time due to the amount of the contract. It was going to take a long time to find such a firm. And the revenue strategy was the piece that we felt we most needed to focus on. The revenue piece was the biggest area from the task force work that was left undone. And so we said, maybe what we can do is peel off the revenue strategy piece of that bigger contract and find a smaller firm for a smaller amount of money and just get that work done or at least moving while we're waiting for a bigger firm to come on board to help us with the overall strategy. We thought that would happen relatively quickly. It sort of worked that way. We certainly got Eco Northwest involved pretty fast, not as fast as we were hoping, but we kind of brought them on board. And so that was the original idea, is that they would just take the revenue strategy piece and get us started on that while we were waiting for you folks to come on. Now that you're both here, though, it seems to me like that was just sort of how we were thinking about it a year ago. And so now that you're both here, in whatever way you can be of use to each other, to the extent your contracts and time allow, I mean, I think, you know, the more the merrier, you know, that, but that's how it came to be.
Yep, that's helpful. Thank you. Okay, so we've got about 12 minutes left. Mimi, do we what do we want to do with the remaining time? We've got some next steps on our deck, which we've talked about a little bit. I think we just added one as well, which was to join the finance, forgot the name of the committee now, finance and
revenue.
Finance and revenue.
Yeah, finance and revenue, F&R, yeah, committee. So are there any other, you know, next steps aside from going to the finance and revenue committee? Anything specific you want from Milliman right away?
I'll defer to Mimi and Lee for this, but my gut impulse is that we should do like a rundown of where PD&E is in terms of eligibility and benefits, instead of rehashing any discussion or reviewing any of that during the committee meeting. I'm wondering if we can just do something where, you know, we can just kind of review what PD has done already, some of the thought processes and decisions we've made, because I think in terms of benefits and eligibility, we're pretty far along. We don't have things finalized. But that's because we're waiting for other pieces. And I think we could do that separate from the committee, just kind of an offline meeting with, you know, a small group of us and get that piece rolling first. That seems like it might be useful. And then PD&E has our committee meeting in 2 days on Thursday. And we are talking about provider reimbursement. We're kind of in the thick of stuff with provider reimbursement. But as you know, of course, there's so many parts that are dependent on other parts and contingencies. And so basically we're using the committee to get feedback and opinions and ideas, and then we're needing to synthesize and reconcile things sort of as more pieces come together. But I think we can do that just with staff, and I'd be happy to participate in that. Would that work, Mimi?
Yeah, I think that's a great idea, Helen, because there have been some larger decisions that are sort of, I call them soft decisions, or not 100% written down, and a lot of it is a contingency. So like, this is the benefit, this is the dream benefit package, and this is a dream eligibility. What will the price tag be? And I think that's where we would like to start with, and then that will enable us to have a better sense when we have that target a little bit more firmed up about the revenue, again, moving around the revenue levers.
Yeah, but we could give you enough information to get started. Like, what I'm imagining is that there's going to be, you know, multiple iterations of a model, and, you know, here's the, you know, platinum model of, you know, if we cover everybody with everything, here's what it would look like. But then we're going to need some variations on that. If we want to bring the cost down, we could take this chunk out or change this in this way or add this cost sharing, you know, so just variations on that. But the Cadillac model, I think we could tell you what that would look like just as a starting point.
Yeah. Yeah, I was thinking about this today, and I suspect that a significant portion of our work is going to be the iterative process of coming up with these different cost levels. I'm sorry, cost levers. You know, what if you charge cost sharing? What if you charge premium? What if you, you know, what if you put in a waiting period? What if you do, you know, all these things? I'm guessing that that's where there's going to be a significant amount of back and forth, and where a lot of our work will do. But to follow up then, so do you, what should we come to the PD&E meeting, or are you suggesting we set up something separate?
Well, both. I think we should set up something separate that is really addresses what the committee has already covered, which is benefits and eligibility.
Okay.
And then you're welcome to come Thursday, where we're talking about provider reimbursement, but I wouldn't want to spend a whole lot of time in that meeting sort of reviewing kind of what we've already covered. So we should do a separate meeting where we just kind of catch you up on what's, you know, what we feel like we've already made some headway on.
Okay, that sounds good. That brings me to a more general question: is should we be I'm assuming you want us in attendance at the PD&E meeting, those meetings and the Finance and Revenue Committee. And then you have a larger meeting as well, right? Where you do
The
the
board
committee
meeting.
readouts, but the actual board meeting.
Yeah.
I'm assuming you want us to be attending those.
I'm going to defer to Mimi on that. How to use your time best.
Yeah, I know. I think that in terms of the committee meetings truly are have been the places where a lot of the work has been getting done. So it may be that you tend to be more present at the committee meetings and not at every board meeting. However,
Gotcha.
when something large is being presented, then that would make a lot of sense to have you
Okay.
there. And it may be, moving forward that might hopefully maybe it'll be every month and you'll be there all the time. But I think that at least for the first part, the committee meetings is where a lot of the work is being done.
So as a takeaway, we'll plan to, and I know all the meetings and stuff. If we don't go to a board meeting, we can go out and get we can go read it, and just stay up to date.
Yeah.
So, but we'll plan to be pretty heavily engaged on the committee, the two committee meetings in particular, the one PD&E and then the Finance and Revenue as needed. Does that make sense?
Cheryl, does that work for you on?
Oh, Cheryl had to drop off.
She dropped off. Oh, okay.
Yeah.
I would defer to her on that and to Morgan. And so, like Morgan, for instance, is going to be speaking at our August meeting because we're going to be spending a lot of time talking about the revenue options that the committee is working on. And so there likely will be times when we'll ask you to come to the board meeting and say, here, give us a rundown of how you think this all fits in, like we're doing with Morgan for August for the revenue strategy. And then PD&E is different than Finance and Revenue in that we only meet once a month. We don't meet twice a month. But I think to your point about sort of moving fast while we've got some time, I think if we set up maybe a regular sort of alternate, every 2 weeks and the alternate 2 weeks of when the committees meet, where we can just kind of talk through some ideas. The committee has a lot of great opinions. It's hard for that committee to come to decisions. And so I think it's useful to sort of talk through I think what the priorities are around the issues. And then you could help us work out, well, we could do it this way and then a separate model that, tried it this way instead, So I think there may be a standing thing where in between PD&E meetings, we can, because there's a lot there. It's a giant committee. It's a giant body of work to work through all of the eligibility and benefits and how to pay providers. And it's just a ton of stuff. And a lot of issues get brought up and very few get resolved.
I got to drop for another quick call, but I'll just say one thing that works well, at least the startup, is we meet weekly with Mimi and team, to just kind of do just basic project management. And then we also meet with Cheryl as part of, just a monthly agenda setting. Those are just useful kind of tracking meetings with staff. And I'm assuming, Fritz, one of the things we could do is try to find a way to, leverage that time and try to early on some of the places where we need to coordinate. So
yeah, perfect.
Okay. It was good meeting everybody. Looking forward to it.
Thank you.
Wild 6 months. So
thank you.
Talk to you soon.
So.
Mimi, is there a particular team that I can work with to start talking through administrative structure?
Yes, well, they are the mighty actually operations team, which was our committee, which was left a little bit out of the discussion. But I think, and Judy Richardson is one of the co-chairs, Bruce is the other, and I think that Kate, that is going to be the group to work with. And I agree. I think that what Morgan was describing has been very helpful. And we don't always have every single meeting, but we kind of set them up, and definitely having our consultant groups meet when we're able to meet with staff and the committee chair is incredibly beneficial. So I think that really helps move things along.
Sounds great. Thanks.
All right. We made it we made it in time. We have some next steps. So
yes, absolutely. I'm delighted. You definitely will be getting so many invitations. I think that we're going to be able to move forward really quickly, and I'm really grateful for you all. Thank you all so much for all of you coming on and taking the time to go over it. I think it was really helpful.
Yeah, we're so grateful to have you on board. Thank you so much too, yeah, for your time.
Very much looking forward to it. So,
All right.
all right, very good.
Thank
Thanks,
you.
everyone. Talk to you
Thanks,
later.
everybody.
Yeah.
Bye-bye.
All right.
Bye.